Hello, hello, hello. It's Constance here, your lactation consultant, presenting for Parenting Genie today on the 8th of October 2025. Now, I would like to talk to you about your baby's growth. Just a small session to give you some ideas what we're looking for. I have taught you some hand expressing last time I went live, and also talked about how little babies need at first when they're born. Because you may remember I showed you a little bit of a tummy size of a baby, so just, a marble size. And then after a few days, the baby grows, or the baby's stomach grows, and then roughly at around 10 days, the baby's stomach is a little bit bigger yet again. Now, in the world, also, at least I should say, here in Australia, excuse me, the parents go with their baby to the maternal and child health nurse or the child health center to have their baby's growth and development checked. So what they get when their baby's born is a child health record. Here in Victoria, where I live, it's a green book. In New South Wales, it may be a blue book, and in Queensland, a red book. And I don't know what it is like in the other parts of the world. And what is going to be put into the book is baby's weight, baby's length, baby's head circumference, and lots of other things, whether the baby has had the first immunizations, whether, the baby is developmentally doing okay, reflexes, all sorts of things will be checked regularly. Now, what we use here in Australia and should be using in the rest of the world is the World Health Organization's growth charts. They were revised quite a few decades ago, and they're based on infants' growth, infants who are breastfed. And so these growth standards are quite universal. And what we're looking for is that babies follow a certain growth on a certain centile. So your maternal and child health nurse or your pediatrician or your GP, whoever is going to monitor your baby's development, your midwife or your lactation consultant, would be putting notes in there or plotting the baby's weight and the baby's length and head circumference into that book. Now, babies lose weight at first. That's quite normal, quite physiological. What we're looking for is usually 7 to 8% of weight loss at day 2 or day 3. So usually we weigh after the baby's birth again at 48 hours. If the baby has lost close to 10%, that is kind of a flag that the baby may need to be monitored for effective feeding and monitored that mom's milk is actually coming through and that the baby is effectively feeding. Now, some babies can be affected through other external factors when it comes to weight loss. Some mothers may have had an induction of labor, or they may have had an epidural anesthesia for the labor, and that means they've had quite a bit of fluid given intravenously. So, and that would augment the baby's birth weight a little bit. So, and when I'm saying augment, that means the baby would have more fluid in the body. And what usually happens is also that those babies would pee a little bit more wet nappies after the birth than would usually be expected. And so we need to take that into account. So so weight loss, 8%, okay, up to 10%, still within range, but certainly a flag to talk to somebody about, is my baby feeding effectively? Is the baby actually taking milk from my breasts? And then babies will be putting on weight again, and usually by roughly 2 weeks, your baby should be back to birth weight. And then what we're looking for is a weight gain of 150 to 200 grams per week in a breastfed baby. That may be a little bit different for some babies who are born prematurely, and sometimes it takes a little bit longer, could take up to 3 weeks for a baby to go back to birth weight if the baby had actually lost more than 10% of its birth weight initially. And then up to usually 2 months, the baby would, actually 3 months, the baby would actually be feeding roughly anywhere between 10 and 12 times in 24 hours. So that means every 2 to 3 hours, the baby would be feeding. And how do you know that your baby is taking enough? Well, it's what goes in, comes out. So you would be looking at baby's nappies. And you should be aiming for poos or stools that look yellow, seedy, mustardy. And so we be looking at that. And we should have at least 5 to 6 pretty saturated wet nappies in 24 hours, possibly more. It depends if you use disposable nappies or cloth nappies. And yeah, babies will have dirty nappies quite frequently in the first few weeks. Now, infant growth or baby's growth does change a little bit after 3 months. So after 3 months, we're looking at 100 to 150 grams a week. And that's between 3 and 6 months. And why is that? It's because babies all starting to become a little bit more active. And so they don't put on as much weight as initially. With that, we're also looking at usually 2 centimeters of head circumference in the first month, and then again 2 centimeters per month. And that means the brain grows incredibly fast in a baby. So by 12 months, the baby's brain is pretty much the size of an adult brain. 6 to 12 months, the weight gain slows down even further, 70 to 120 grams. And by 6 months, you would usually introduce other foods into your baby as well. So you would start with some solids. However, breast milk is still the main source of nutrition for a baby in the first 12 months. In terms of how often does my baby feed, once babies have become quite efficient with breastfeeding and your milk supply has sort of settled to just meet your baby's needs, you might find that the baby only feeds 6 to 8 times in 24 hours. Night feeds are quite important. And what you would be reading a lot about these days is what is considered responsive feeding. And responsive feeding is not something that happens for breastfed babies. It happens also for babies who are fed supplemental foods like a formula. And what it stands for is to not feed your baby by the clock, to say, oh, it's nearly 5 o'clock and my baby hasn't actually woken up for a feed and I better wake it up and feed it. No, you would wait that your baby wakes up and shows you feeding cues. And feeding cues is starting to root, starting to suck on the hands, stretching, yawning. And then when your baby starts crying, that is actually what is considered a late feeding cue. That's almost too late. Then you calm your baby down again before you start feeding. So work with your baby's cues. Rooting, hands to mouth, restlessness, they are the cues, and that's the best time to start feeding your baby. Sometimes there's other reasons why you would wake your baby up. So if their baby was born a little bit early and is a sleepy baby who hasn't really just gotten used to the world outside the womb, then you may have to wake your baby up for feeds and wake your baby up with skin-to-skin contact so that you switch on your baby's signals and your baby's brain and your baby's reflexes for feeding. So that best is always to do that in skin-to-skin contact. Now, after 6 weeks, the stool frequency in the baby may vary a little bit more. It should stay soft. If your baby starts having signs of harder stools, that would not be quite normal. That would be a good idea to talk to your maternal child health nurse, your midwife, or your GP or practitioner about. And also, if there is dark nappies in terms of darker urine, that would also mean that the urine is too concentrated. So we usually look at pale urine, and that is always a good sign. If your baby has got something that is called a sunken fontanelle, so if there's openings, little diamond shape, they're called fontanelles. There's one here and one there. In fact, I can show it to you. So there would be one at the back. This baby has too much hair, can't show it to you. And then there would be one there. So if the fontanelle feels kind of sunken in, that can be a sign of dehydration and it may need to be checking out. If your baby is really sleepy and hard to wake up for feeds, that would also be a sign to discuss it with your health practitioner or your midwife, because babies are driven by wanting to feed. So if they don't wake up for feeds regularly, then that means that they may actually want to conserve energy, and that would be a reason to discuss feeding assessment there. Persistent nipple pain and also any supply concerns need to be addressed. And certainly early support would mean the best support to turn the wheel around if there's concern that your baby is not getting enough of your milk or not eating enough. If you would like to have more information on that topic, on how do I know that my baby is doing well, how do I know that I'm breastfeeding well, you could consider a 2 weeks free membership with parentinggenie.com, and you would get access to a lot of files and a lot of videos and educational material to address this subject. And thank you so much for listening today to me. And I would see you again in a week's time on a different topic, feeding your precious baby or babies. And see you then. Thank you.